have been doing a lot of research on why people need health coverage and some of the plans that are inexpensive so people have an opportunity to have health insurance. So I've done my research on the Affordable Health Care Act. What is the Affordable Health Care Act? Well, it's basically Obamacare, which is a law in the U.S. That is aimed on getting a lot of people who can't pay the normal fee of health insurance get it kind of at a lower cost. What does the Affordable Health Care Act do? It's giving people chances to get cheaper health insurance, and also teens 18 and up to 26 years old can stay on their parents' health plan until they can pay for it on their own. Also when people Also, when you have this plan, it's preventing you from having diseases and injuries. And so it's giving you health insurance to rely on if you get hurt or very sick. The cost of this act normally goes by how much someone gets paid. Obviously, if you get paid under the price of what you should be getting, and many Americans will qualify for lower costs on monthly premiums, but you will normally pay 3 to 9.5% of your income. And it's not all about how cheap health insurance is, it's the fact that you are given the opportunity to get full health coverage when you normally had to pay a ton of money on in the past. Why is health insurance so important? Well, like Ray said, no one plans on getting seriously hurt or sick, but when you never know what life has in store for you. Also, you as a person might think you're very healthy, but someone in your family might not be very healthy. Or he or she falls and breaks a bone, and you don't have health insurance, and that's bad luck for you because you'll be paying that big hospital bill by yourself, and it's a lot of money. As to if you have health insurance, your plan will most likely have covered, and you'll only have to pay some of the bill. So basically, I'm trying to say is the Affordable Health Care Act is not a bad thing at all. It is here to help you and make you pay lower costs for health insurance.
Guys, please, and enough of this talking over here. I'm fed up with you lot. Well, the same people that sabotage Mondays and Day. Kendall?
Being the opposition team and against the United States providing universal health care for all citizens, we believe that making citizens have Obamacare, if they don't have insurance already, is against freedom of rights for all citizens. Many teens and young adults have gotten cancellation notices from their insurance companies because of the Obamacare. This means not having insurance will be forced to get Obamacare, or will be fined for not having insurance. Again, this is taken away from our country's freedom. We should choose whether we need health care. They are making citizens pay they cannot afford health care, but on top of that, if they can't afford the health care, they will be fined for not having enough money to pay for the health care. Many people just have the Obamacare because they lost their other insurance and needed to be insured. Numerous people have suggested that not having health care is 5 times cheaper than having insurance. Recent studies on insurance for young adults show that being insured will cost upwards of $700 more for individuals who visit the ER and have insurance. Uninsured young adults who visit the ER once in 2014 will pay $2,200 annual out-of-pocket expenses. Meanwhile, uninsured adults will have a bill of $2,791 out-of-pocket expenses. To cover ER visits, it's better to not have insurance and have to visit the ER. Obama is taking money away from the United States for this health plan. He took $6 billion away from Medicare to pay for Obamacare. Therefore, they're taking away from the elderly and disabled. Also, the journal had said that they will spend $500 million on local TV ads in 2014. They're taking away even more money from citizens than they should. Many people have reasons why they don't need insurance. 95.8% say their health is good, very good, or excellent, and they don't have insurance. Additionally, 30% say they will never see a doctor. They will not even see a doctor once a year. Ages 18 to 29, less than a quarter said they visited an ER once during a 1-year period, and only 7% stayed overnight. Only 4.2 say their health is poor and they don't have insurance. This healthcare is being very unfair to the cost too. Someone healthy has to pay the same amount of money as a person who smokes 3 packs of cigarettes a day. Only 11% say that some had signed up for the healthcare were uninsured. The rest had been switched over. 40% had their plans switched. We believe that forcing citizens to have healthcare is against the freedom rights. We should have the right to choose whether we want universal healthcare. All Obama is doing is making another tax on the citizens.